So the first thing I'm going to do is I'm going to recheck some muscles that we tested yesterday that were extremely weak in her arm and shoulder. So we're going to start with her right anterior deltoid muscle. So we're going to have you put your arm here, and I want you to keep your elbow locked, and I'm going to push down. Don't let me do it. Resist me. Ready? Resist. Okay, so no strength there at all. Now we're going to go out sideways, and that does the medial part of the deltoid. Don't let me push. Okay, and we're going to check a muscle called the supraspinatus muscle, which is in the back here, the rotator cuff muscle. I said spinatus, but it's supraspinalis. So hold here, don't let me pull down. You push backwards, ready? Push backwards. Okay, very weak. And now I'd like you to lay down on your back, please, face up. Now we're going to just simply check the strength of her neck muscles, the anterior neck flexors. So what I'd like you to do is bend your head up like you're looking at your toes. Can you hold that up yourself?
Yes.
Yes? Now don't let me push it down. And I don't know if you could tell, but with very little pressure, she's not able to hold her neck up. Now I want you to take your right arm and bring it straight up in the air. And we're going to test part of the chest muscle, or the pec clavicular muscle. So take your arm and your hand and put it towards me, and don't let me pull it down. Ready? Very weak. Okay. Now we're going to check a muscle underneath here called the serratus anterior. So put your thumb up, and I'm going to push your arm down towards your toes like a slot machine. Don't let me. Okay. So all those muscles on her first initial exam were tested to be weak, and I just reconfirmed them now. They're all weak. Now I'm going to show you some techniques to actually strengthen those muscles almost within seconds or minutes. So the first thing we're going to do is we're going to do some points to hopefully strengthen her neck muscles. Now there's 2 points here on where the collarbone meets the chest that will strengthen the neck muscles. Now there's a couple different things to check. This is number 1 in the protocol. If this works by putting some pressure here and it makes her neck stronger, I know then I'm going to do some acupressure and actually treat these points, and that's going to help the healing process. So Pat, so I can push down on your neck, I want you to take your 2 fingers, first 2 fingers with both hands, and place them right where my fingers are. Just go on top of them, first 2, and just touch right here. Okay? Now I want you to bend your head up and hold it up now. Don't let me push down. Now it's still weak. Push up. Hold up. It's still weak, but it seems to me like it's stronger than it was. Is it to you?
Yes.
Okay. So that tells me the fact that it got stronger, it's treatable. How cool is that, that you can not only figure out where the problem is, but you can test it to see if it's treatable before you waste time treating her. I like that. So I'm going to write that down in her notes. And then we're going to go back and treat it in a second. The next thing we're going to do is we're going to test her shoulder muscles. So sit up for me, if you don't mind, and face that way. Okay. The anterior part, or the front part of her shoulder, was weak before. So again, let me check it. Don't let me press down. Okay. Now there's a point right here in the sternal area, the rib cage. So what I want you to do is make your fingers kind of like this, spread them out a little bit, and I want you to touch yourself right about here and hold it. You don't have to push hard, just touch. Now hold your arm up and don't let me push down. Does that seem stronger to you now?
Yes.
Push up, push up, push up, push up. Yeah. You're definitely able to lock that muscle. Isn't that interesting?
Yes.
Okay. We'll talk about that in a second, but that's a good thing. Another thing I'm going to check, because I believe it's really coming from the neck, is I'm going to touch some of the vertebrae here and check to see if strength comes back. I'm going to put a little pressure on the upper neck. Don't let me push down. A little stronger. Middle neck. Don't let me push down. Much stronger. Lower neck. A little pressure here to get rid of some of the compression here. And don't let me push down. Okay. not as strong. Middle neck seemed to give the biggest strength. Is that true to you?
Yes.
Right. So I'm on the middle neck again. Don't let me push down. Wow, very strong.
Yes.
Okay, so I'm going to write that in my notes as the middle neck gives the best strength for the deltoid muscle. Okay, another muscle that I want to check is your supraspinalis muscle, which is a small muscle in your back, part of the rotator cuff. So bring this up here again. Don't let me pull down. Ready? Push backwards. Again, that's weak. So that happens to be, again, right about here. So put your fingers right here for me. Okay? This muscle happens to be related to the thyroid. In Chinese medicine, every muscle relates to an organ. So don't let me push down. You feel stronger?
Yes.
Pretty cool, huh?
I don't understand it.
I know, it's hard to understand, and there are connections, but it would take me an hour to explain it to you right now.
But
Later we'll show you.
It's working.
And results are what you're looking for, right?
Exactly.
Okay, so let's fix it.
Right.
Okay, the first thing we're going to do, how much minutes?
You got 2 minutes left.
Okay, now we're going to do the treatment. Instead of rubbing with the pressure points, I'm going to use my massager. It's just more forgiving to the patient. It doesn't hurt as much. So I'm going to use some pressure here. Is that okay?
Strange.
Strange, but not hurting too much?
No.
Okay, good. Also, as you get more efficient at this technique, you want to look for the highest priority point, because sometimes if you find the highest priority point and just clear that, all the secondary and tertiary and lower priority issues will clear out on their own. That's what the Chinese were all about, efficiency, getting the job done right and quick. Now I want you to sing a song while we're doing this.
Like Darth Vader.
Just kidding. And just for the heck of it, I'm going to do a little stimulation right on the shoulder. I really don't believe there's actual injury in the shoulder. I just think there's a blockage of energy coming down from the neck. And then I'm going to do a little bit of pressure there. Is that too much for you?
I feel a little lightheaded.
Okay, we don't want that to happen. Okay, so we're done with that. Now, you've never had a chiropractic adjustment before, have you?
Many years ago.
Do you remember what it feels like? And you might hear the popping from...
Yes.
Okay. You might hear some popping. All that is gases being released from the joint where I adjust.
Okay.
Are you okay with me doing your first one here? Because you really need a good release right there.
Yes.
Okay, so I'm going to do a neck adjustment in the middle part of her neck where I tested her shoulder to become the strongest when I put my attention there. So we're going to just gently feel that area again. There it is. And excuse my back, but we're going to come here, tilt your head, relax your neck, and we're going to look up to the sky, and we're going to adjust. Did that hurt?
No.
Very good. You're over 10. Okay. So now we're going to check, and we're going to see if these muscles are strong now. Don't let me push. How's that? Strong?
Much better.
Don't let me push. And turn your ear. Don't let me pull down. Look how strong that is. Now one more thing I want to do is lay down on your back again, please. And we're going to check your neck muscles. Okay. Now bend up your head like you're looking at your toes. Hold it there. Don't let me push down. I'm really pushing. Again, hold up. Don't let me push down. I'm really pushing. You tell me. What's the difference?
It's just amazing.
Well, tell me what happened.
I can fight back now. I
Yes.
had no strength before.
So what we did was we turned on those muscles by removing the blockages of the energy in both in your spine and in the acupuncture meridians. Now you have more energy flowing through your body, which means that your body's going to be able to heal more efficiently, quicker, and better. So this is your first visit,
Yes.
but we've already done a lot to stimulate the healing process and get you on the mend.